Primary aim of total hip replacement surgery is restore center of rotation, correct lip length, number 3, correct offset and abductor tension, and proper component positioning. When asked about choice of implant, I would say that I will use a C-stem implant. Normally, it is on Exeter philosophy and has a 13A plus ODEP rating. It is a hip that provides me with ability to deal with anatomical variance and achieve all the primary aims of total hip replacement. It has a good initial fixation and good long-term survival as per NGR, or I am trained. That's why I am familiar with instrumentation. Preferred choice of implant when asked, talk about versatility, longevity, survival, patient-related outcome measure, and the principles. For the acetabulum, Exeter contemporary flanged cemented cup or a trident uncemented 13A plus ODEP rating. Regarding ODEP rating, it is initiated in response to NICE pre-entry 3, 5, 7, 10, and 13 years. 13 plus A plus rating, the highest score, represent 13 years of evidence. A is a strong evidence, B is a reasonable evidence, and C is a weak evidence. Minimum cohort of 500 hips or knees should be done. Data from beyond developing countries and from more than 3 centers/surgeons. Revision rate at minimum 10 years follow-up should be less than 5% for A plus uh, and less than 10% for A. So if you have a A rating, this means that the revision is less than 10%. A plus means revision rate less than 5%. Maximum of 20% of the loss in the follow-up is permitted.